All right, so for the fourth kind of component, we're looking at your ability to maintain your posture with your arms overhead. So one of the first tests and one of the ones that's most difficult for most people is the overhead squat. So here, kind of assessing both from front, behind, and to the side. We're going to ask a person to have their feet about shoulder width apart, toes pointing ahead, arms straight up, and then from that position, dropping it down as far as they can in that squat and back up. Ideally, we're getting to our hips are going just slightly below parallel and still maintaining kind of a similar angle between your arms and your shins at that bottom position. The next part is just called the Lat Test. So the Lat Test, if we have the ability to use a wall, this is what this is designed for. If we're outside at a course, we'll do a slightly different variation. But here, we're getting into a little bit of a wall sit. We're gonna ask you to keep your core engaged, and then from here, just raising straight up without letting your back arch off of the wall. And we wanna see, can you get both arms as high as you can, ideally getting to the wall from that position. And then the last one, we're looking at just shoulder external rotation mobility. So first we're going to assess that just in normal stance. You're going to get into a 90-90 position here, and then you're going to externally rotate as far as you can. And we're trying to see if you can get, how far you get relative to your spine angle. So are you short of the spine angle, equal to, or greater than your spine angle? Taking note of that, we'll then ask you to get into your golf stance, set up posture. You're still getting into that 90-90, so we're starting hopefully close to what's at least equal to spine angle and seeing if you're consistent and can get beyond that spine angle. And we'll look at both sides, but your trail side is going to be the more important side with regards to the swing, but your lead side will have some impact. Then the last couple of tests is really looking at the ability to set the club and release the club through the swing. So we're just looking at wrist and forearm mobility. So one, we're just looking at supination, pronation of the wrist. Next, we're going to look at holding on to a fist, looking at wrist flexion, wrist extension, and then looking at wrist ulnar deviation and radial deviation. And we're looking for circle marks there. So those are the 15 main tests for the screen. Like I said, some tests, depending on where we're doing the test, might have a couple variants, just so we can still assess with the equipment and space that we have available. So if anybody who plays golf or has recently kind of taken up the game, especially with COVID and golf being something that we're thankfully able to continue to do, if you're interested in learning more about how your movement abilities affect your golf swing, feel free to reach out and give us a call, and we'd be happy to check you out.